Hello, everyone. Thank you for joining us for today's webinar, which is about the PT MACS tool overview and adoption considerations for DPT student performance assessment within Exxat Prism. We do have quite a lengthy list of presenters and panelists today. We have Jane Smith, we have Beth Schaefer, Erin Hicks, Peggy Geeson, and Christopher Wiedemann here with us today. If you have any questions throughout the webinar, please add your questions in the questions box. We will be pausing periodically to ensure your questions are answered. As usual, you can download today's presentation to follow along or keep as a reference. You can find that in the handout section. This webinar will be recorded and shared with you along with the presentation via email 1 hour after the webinar ends, and will also be made available on our YouTube channel. And without further ado, Jean, if you're all set, we can go ahead and get started.
Excellent. Thank you so much, Rocio. Good morning, everyone. Thank you so much for joining us, spending some of your Friday and precious time to learn a bit about the Physical Therapist Manual for the Assessment of Clinical Skills, or PT MACS for short. As we navigate through our agenda this morning, just a brief overview. We'll provide the history of the PT MACS and the tool prior to it, known as the Blue MACS, as well as an overview of the tool. We'll go through a case example for the adoption process that Chris will share with you as he was considering different performance assessment tool options for his program, and also spend a bit of time on CAPT compliance and how the PT MACS does consider the compliance components, the standards, and ensuring that we are meeting those standards with some updates in the future to come. And we will discuss use of the tool, how we apply it. Different schools have maybe slightly different applications. So we'll give you an example of that implementation. We will also share the workflow overview visible within Prism, in navigating that process for both the student and the clinical instructor. And then finally, we will have some panel discussion from the perspective of directors of clinical education, tool developer, editor, and clinical instructor, and site coordinator of clinical education. Erin wears several hats there. So without further ado, we'll discuss the history. And so this tool does have a lengthy history. It was developed in 1977 initially. Oops. Sorry, I just scooted my own view. I think you all can still see the slides though. Yes. Okay. So in 1977, the Texas Consortium for PT Clinical Education developed a tool to capture student performance and based this on the APTA standards of practice at the time. It was published and used throughout Texas PT programs. And before the CPI was developed by the APTA in 1997, over 50% of US PT programs used the Blue MACS. There were 6 editions in total of the Blue MACS, with the last one being used as late as 2004. So the length of that tool was pretty substantial. In 2001, a new task force within the Texas Consortium completed an updated tool, which they labeled the PT MACS. The acronym for MACS did change, but the developers of the new tool agreed that they wanted to keep that MACS component, the identification of the tool. So with the Blue MACS, it was known as Mastery and Assessment of Clinical Skills. And then as we changed to the PT MACS, it became a manual assessment for assessment of clinical skills. And with the updated tool, there was a pilot that was initiated in 2001 by University of Texas, El Paso and Texas Tech to test this tool with students and clinical instructors received feedback from the clinical instructors, and then made further edits to develop version 2. And this version 2 is what was published as the PT MACS first edition. Documents that informed the development of the PT MACS were the generic abilities, the guide to PT practice, and the APTA normative model for PT profession. Okay. And then in 2014, a task force was again put together to begin revisions for the PT MACS second edition. At this point in time, it was necessary to update terminology to be consistent with current and contemporary practice. The second edition was informed by the International Classification of Functioning Disability and Health language, generic abilities, and CAPD standards. In 2015, the second edition of the PT MACS was published. This was in hard copy form. In 2016, a review of the PT MACS skills was conducted to confirm it aligned with the newly updated CAPD standards that were released in 2016. And then in 2018, the PT MACS was developed within the version 3 of Exxat, as the Texas Consortium collaborated with Exxat's team to make this tool electronic. And at this time, we no longer publish the hard copies. We are strictly an electronic tool. Okay, as far as research for content validity, we do have several articles. In 2005, Lois Stickley assessed the content validity of the PT MACS first edition. Utilizing chi-square goodness of fit tests, she found 28 academic coordinators or directors of clinical education strongly agreed that 50 of 53 skills matched the criteria from the Guide to PT Practice and or a normative model. So 94% agreement there. They also indicated with a visual analog scale that the PT MACS describes student behaviors needed for success in a clinical education experience. And so the takeaway from this study was that there is good content validity. In 2012, Ludka Hoffman and other members of the Texas Consortium explored the relationship between the PT MACS and the national PT exam scores. Their inter-item analysis of the PT MACS skills demonstrated good internal consistency reliability. They did find in conclusion that the PT GPA demonstrated the greatest relationship with success on the NPTE, reinforcing findings of previous studies. And now I'll turn it over to Chris to share his story.
Yeah, thanks, Jane. My name is Chris Weidman. I'm a Director of Clinical Education for the Hybrid Doctor of Physical Therapy program at Allen College in Waterloo, Iowa, so well outside the state of Texas. So, and just to give you a little bit of background there, the Hybrid DPT program, we're a brand new program. In fact, we just had our site visit for initial accreditation this week. So we began developing the program really from scratch in 2018. We admitted our first cohort in the spring term of 2021, and that cohort is currently out on their final clinicals right now, with anticipated graduation in the fall term of this year. And so, you know, for me, I came on as one of the original core faculty members, as the original DCE, and I think maybe we're using this case example for an adoption process because for me, my experience as a DCE, I came from 20 years in the clinic as a clinic manager, SCCE, CI, and clinician, and somewhat unique to maybe the experience of a lot of DCEs that transition from the clinic and into academia, because there was no program that I inherited. A lot of times people come to an established program, and there's already that clinical education program in place, clinical experience is already in place, and along with that, the assessment tool, most DCs come in and they inherit the assessment tool that the program has been using historically. And in my case, I had to go through the the full backward design process that we do in academics, just like any other course, including deciding how I wanted to assess my students' performance in the clinic. So in the next slide here, kind of what I wanted to talk through everybody on is really what my mindset was for that, for that backward design, and how it led me to choose the PT MACS over some of the other options, that were available to me for assessing student performance in the clinic. So, for those of you maybe that don't, work in academia full time, as we go through a backward design process, we do that anytime we create a new course, whether it's continuing education, a course within a DPT curriculum or what have you. We really begin with the end in mind, which is, what are the course objectives? At the end of the course, what do we want our students to be able to show us that they're capable of doing, or what they know, or what have you? And so we have 4 clinical experiences in our program. And again, I had kind of the unique opportunity to write those syllabi and write those course objectives from scratch, and write them in a progressive way, as they progress from clinical 1 to 4. And so once I had those course objectives down, really what I began looking for was a way to assess effectively whether my students were meeting those. For those of you who are in academia, you know what the 7 Ds are. For those of you out there that are clinicians, there's standards and required elements. Standard 7 has multiple substandards, and 7D in the CAPD standards that they look at for accrediting program is really all of the content areas, and there's a lot of them that they expect a PT program to assess. And I won't go into detail because I think we're going to talk about that a little later in more specificity, but really that informed my course objectives, informed what areas do I need to be able to effectively assess, and therefore how am I going to write my course objectives for these courses. And once that was done, I really needed an assessment tool that would have the specificity to allow me and to allow my clinical instructors for us to be able to tell if my students actually met the course objectives as outlined in the syllabi, and also meeting all of those myriad areas, content areas that we needed to make sure that they were proficient in and entry level in by the time they finished their clinical experiences. So, and as a new program, believe it or not, there are some specific, items that they ask us to present when we first submit to CAPD, even before we are allowed to matriculate a course. And I distinctly remember one of them saying that you have to submit a copy of the assessment tool you're going to use, unless you choose the CPI or the PT MACS. So as a brand new program, I was really looking primarily at that point of comparing those two, and which of these 2 tools did I think would give me the specificity necessary, but to really assess my course objectives, but also enough specificity to tell if we were meeting those different 7D requirements, as we mapped our curriculum. But also, too, one thing that I thought was really important for me, coming from 2 decades in the clinic to an academic position, I consider myself as the DC, the liaison between my academic program and the broader clinical community. And so I also was I really wanted a tool where I could get specific information on what our students obviously do well individually. So if I have a CI call me, or I look at a midterm score and they say, this is an area they're having issues with, I wanted to have a tool that was specific enough that I could know exactly where I might need to intervene. But likewise, as I looked at our students on the whole, so I looked at my whole cohort that are out on clinical experiences, I wanted a tool that was specific enough that I could take student performance back to the rest of the core faculty, and back to my academic program, and be able to say, these are areas where our students are performing well. These are areas where maybe we need to take a little bit deeper look at our curriculum, or deeper look at the courses within our curriculum, and give specific feedback. This is where our students on the whole are doing well. Hey, here's some areas where a good percentage of the students in this cohort didn't necessarily perform as well as we thought they would. And that's informative for, that's a role that I play, and that's informative for us as an academic program as well. And so those were kind of the criteria that I really looked at in determining which assessment tool would allow me to meet all of those needs. And in the next slide, what I'll show you here is really that kind of is what led me to the PT MACS. So here in the Midwest, the PT MACS is not commonly used. The vast majority, especially of my local CIs, have never heard of it, actually. And to be honest, before I came into academia, I trained in the Midwest. I've only practiced in the Midwest and had not been exposed to it either. But really, when I looked at all of the things that I was looking for in an assessment tool, I felt that the PT MACS, its specificity, which you'll see in the latter part of this presentation today, how it broke down not in just these broad areas of professionalism or practice, but gave very, very specific categories I felt was going to be the most effective way for me to be able to assess student performance. But there were other components of it as well that I thought were particularly applicable to us as a hybrid program. And that was also its accessibility, its portability, and being housed on a reliable tech platform. As a hybrid program, not all our faculty, I live here locally where our program is housed, but the rest of our faculty do not. So I was also looking for a tool that, say I'm sick, say I'm on vacation during a clinical, I end up in the hospital and the program director needs to be able to access those files. You know, it needed to be something that was accessible, that was portable, that could be accessed from anywhere in the country. And that was an additional advantage that I felt as a hybrid program was important to us. But in reality, I think that's probably translates well to even a traditional quote unquote brick and mortar or residential program, because unlike if you're in a traditional program, unlike the other courses that are presented, on campus, your students, if they're on clinical experiences, could be anywhere in the country. They're not necessarily on campus either. And so that was an additional consideration that I took, given our format, but also giving kind of that inherent nature of clinical education, that I needed to make sure it was accessible, portable, and housed within a reliable tech platform. We were already using Exxat as our clinical education management system, so it made sense to have a single platform that my students and my clinical instructors were going to be accessing. And then the final thing, and this was maybe one thing I anticipated, especially in the Midwest, being a bit of a hurdle, was ease of use and acceptability to my clinical instructors. We sign contracts, with our clinical, affiliation agreements with our sites, and they all say that the CIs agree to use our forms and things like this, but those CIs are also not usually the ones signing the contracts. So this was also a concern that I had, knowing that a good portion of our clinical instructors would never have been exposed to this tool. And this is by no means a statistical study in any way, but just anecdotally, I did do a lot of site visits, as I was recruiting new sites and talking about our new program, and talking to clinical instructors that I knew had never seen this tool before, and presenting to them as what I was thinking about using. And I didn't get a single piece of negative feedback. In fact, I think what a lot of the clinical instructors said was really they just wanted all the same stuff that I wanted in an assessment tool, which they wanted it accessible. They wanted it to be on a reliable tech platform. They didn't want it to be highly complicated, and they wanted it to be something that was easy to rank students and easy to train on. And so as I looked at all those things, really kind of the PT MACS ticked off all of those boxes for me as we were developing this new program. So that's kind of how we, as a brand new program, going through that backward design process, led to choosing the PT MACS over some of the other more widely available tools that were available to us.
I think, we are going to talk about the 70s. I'll introduce myself. I'm Beth Schaefer. I'm the Director of Clinical Education at Hardin-Simmons University in Abilene, Texas. And going through exactly what Chris was just talking about, the for CAPT compliance, making sure that the PT MACS does meet all of the 7 Ds. And what we have here are several slides listing all of the requirements. And what we have done is gone through and matched up how does the PT MACS in each of its skills, how does that meet the criteria that CAPT is wanting for accreditation? And so we were able to pair and match every single one of the requirements. And actually, the PT MACS has a few more skills out there that we have our students check off. That's not like a mandatory thing, but it's good for our students to have in there. So I know this is really small. You can't read a whole lot on there. So I'll kind of go over a few of them. Some of them: practice in a manner consistent with the APTA Code of Ethics, their core values. Identify, respect, and act with consideration for patients, clients, differences, values, preferences, and expressed needs in all professional activities. Access and critically analyze scientific literature. So these are just a few things. And then it also goes into more of the examination and evaluation diagnosis. So perform a systems review, obtain a history and relevant information from the patient, evaluate the data and examination through history, health records, systems review, test measures. Another one is determine a diagnosis that guides the future patient-client management. So these are the 7 Ds that APTA has put out there that we need to meet as far as each PT school, and through ClinEd, how can we meet this criteria, and we can show that our students have been proficient in these whenever they get checked off on their PT MACS. So each of these skills, as they get it checked off, show that we are in compliance. We are meeting each of these criteria from the APTA. It also goes into interventions and then management of care delivery, like monitor and adjust the plan of care according to the patient's needs, and respond effectively to patient and client environmental emergencies in one's practice settings. And so one of the big components to APTA is safety for our CIs, safety for our, obviously, students, and safety for our patients. And that's a big one on here that the PT MACS has specifically on there, their safety components, to make sure that our students are getting that one checked off. And then for the 7 Ds, it also goes through participation in healthcare environments, participate in activities for ongoing assessment and improvement of quality services, use health informatics in the healthcare environment. So a lot of this may be pretty confusing when you're looking at it into the PT world. You're like, well, I don't know how our students are meeting all of those. Well, we've kind of put it in for the PT MACS. We've put it in terms that our CIs will understand and our students will be able to utilize. And we've broken it down into different categories on the PT MACS. You can go to the next. So the PT MACS, there's a total of 60 skills. Now, anybody that has used the, let's say, CPI before, you look at 60 and you're like, oh my goodness, that seems like a lot. But we've broken it down into our generic skills, and then we have our site-specific skills. And then each of those skills, and we'll go through each of those, they're broken down into different categories as well. So it's not that we're grading on the student on just a general basis. Are they professional or are they not? we break these things down into specific criteria that we want our students to be able to master. So when we go on to the next one, when we set up our grading, our ratings for the PT MACS, we have 5 different ratings that we can use. We at the very top is above entry level. So this is when they are going above and beyond. They master whatever skill that is, and they exceed any of our expectations for that skill. And then if we feel like, or the CI is grading them, and the CI feels like they have met this skill and they are at entry level, they don't need assistance anymore, then they get a check mark. The next skill down, or this next level down, is an NI. So that one just needs improvement. So maybe they're working on it. They need just a little bit of assistance. So the CI can rate them as NI. The next one is unacceptable, is a U. So this is one that we as DCEs, we do not like our students to get a U. We don't like unacceptables, but sometimes it presents a problem. And this is a good way for any of your CIs to have a conversation with the student and then be able to have that justification to call the DCE and say, you know what, I feel like we just have a problem here that we need to address. So sometimes that's a hard conversation. Should I call them? Should I not? But whenever you're rating them and you end up putting a U, that is a good indicator of, okay, so this is my time that I do need to call my DCE. And so it's kind of an eye opener for the student, and for the CI, it kind of gives them some relief of justifying calling the DCE. And then we also have NA. Not every clinical rotation you're going to be seeing every single one of these skills. So if that skill is not addressed, or maybe they've just kind of seen it a little bit but not really worked on it, then they just put in NA, that it is not applicable for this clinic. So let's kind of go through, we're going to break down our skills. We have 5 different sections that we have put them in. The first one is our professional behaviors. These are all of our skills, and we'll go through them in a minute. So then we have our patient-client management. Okay, anything, any hands-on that we do with our with the student, with the patient, then we'll have these skills listed here. Also with the management of care delivery, and then we have the practice management. That's a little more on the financial side or the business side of things, getting them to see the whole aspect of a clinic and not just purely patient care. And then we have the last one is site-specific skills. So these are skills that they may see in the clinic, but they may not. So it's per site that they may see some of these things. So let's go through some of the professional behaviors that we're going to see. Okay, so there are the first 11. So we've broken down professional behaviors. So instead of saying when a CI is grading a student, instead of putting out there, oh, yep, I check them off, they're professional. So instead of doing that, we've broken it down into several categories. So maybe they're good in some areas, but they need help and a little assistance in other areas. So this is an excellent way for the CIs to say, okay, we really need to work more on our problem solving, but you're great with your communication. Okay, so the professionalism, that's of, do they get there early? Are they dressed appropriate? How are they just doing professionally coming into that clinic? And then a commitment to learning. Are they showing that they want to be there and they want to learn? Interpersonal skills. I'm not going to go through each of these. You can read each of these skills, but I think for me, professional behavior says a lot about our student. So I really emphasize the professional behaviors with them, making sure that they are appropriate in the clinic. So a lot of times our students on the problem solving and the critical thinking may not get that checked off on some of the first couple of rotations, because those are a little more difficult. Those are higher level. How can you critically think through this problem and come up with your solution? And then obviously one of the big ones is constructive feedback. We want our students to be able to receive that feedback and not get defensive and not think that they have to know it all, but to utilize that feedback, implement it immediately, and go on with that new information that they've just gathered. So these are the things that we want to see from our students. And so breaking it down into each of these different categories is a great way for us to see that they are on the right track. All right, the next one is patient-client management. So this is going to be hands-on with the patient. So right at first, taking a good history, doing a systems review. Are they doing some chart reviews right at the beginning, learning about this patient at the beginning, and then working on our tests and measures. Okay, so instead of just saying, yep, check mark, they're able to do an evaluation, we're breaking that eval down now into our subjective, our objective, our assessment, and our plan. We're breaking each of these down, and then each of these categories we're able to break down, because not every time will posture be addressed with a patient, but a lot of times it will. So we have posture as its own assessment on here to be checked off. So all of these skills we have now broken down, things that they may see on an evaluation. Aerobic capacity, arousal and mentation, a lot of times in acute care, that they'll need that. Joint mobility, mobilization, then we have, muscle performance, posture, neuromotor, range of motion, even goes into self-care and some skin integrity. So we break down each of these skills so that not only can the CI see where do they need to focus, maybe at midterm, they can see where those NIs are and what things do they need to focus on for that final assessment. But it's a good way for a DCE to see how are they presenting in the clinic, what things are they going to be working on in order to meet those checkoffs for their final. Okay, so the next section, examination and evaluation. So during that initial eval, first they kind of examine the patient, making sure it is appropriate for them to be there, and doing an evaluation and coming up with the PT diagnosis. With that, going along with their prognosis. Are they able to come up with their own prognosis and their plan of care? Again, we've kind of broken these two skills separate because we need our students to be able to understand the difference and to understand thinking long-term. Are they able to come up with a good plan of care? And then all the interventions, modalities, and there are modalities that are listed in the PT MACS, but then there's also different blanks that can be filled out as well. So maybe there's not a modality that was listed, but it was performed in the clinic. They're able to write it in. Equipment selection. Again, there's some listed, but then there's open blanks so that if your clinic does something that's not listed on the PT MACS, then it is able to write it in. Functional activity training, gait training, manual therapy. Manual therapy, again, you could write in what specific joint mobs if you wanted to write that. Some soft tissue mobilization, some manual traction. So any of your manual therapies, you can get specific in there and say exactly what all that student has been able to show and demonstrate. Therapeutic exercise. Obviously there's 1,000 different exercises that can be done, but you can generalize and say, for the most part, they're, aerobic exercises are doing great. If we are working on conditioning, if we are working on mat exercises, or you can get as specific or generalized on reporting on like the exercises portion of it. And then the last one that we have, other than the site specific, is the management of care. So our number one skill that we need to be emphasizing is the safety. So again, like I had said before, safety not only for the patient, but for the CI and for the student. So the student has to be able to show that there are safety components through all aspects of whatever their care is for the patient. And then any interprofessional collaboration, so interdiscipline team, working with a technician even, working with PTA, going and talking with a nursing staff, for the treatment for that patient. So are they able to reach out to others to be able to get the best quality care for that patient? And then there's outcome assessments, and then looking at their documentation, looking at their supervision and direction. So this one is another one, looking at, can they talk to the PTA and give them directions into what they expect that they want during treatment for that PTA or for that technician. And then the last one is, there's one more. Practice management is the payment or reimbursement. Are they able to do all of their charging correctly? Obviously, students with Medicare is kind of a fine line in there. And so they need to understand, was I one-on-one with my CI with me so we can charge the full amount? Or, do we need to decrease some of these charges because the CI was with another patient for half of the visit? So they have to understand the proper reimbursement, proper payments that they need to put in there. And then a lot of times the financial aspect of the clinic too. So our students get exposed to that with a lot of our clinics. They can see the business part of it. And then I believe the last one now is the site specific. So like I said, there are many skills listed for the site specific, and these can go from prosthetics, vestibular, wound care, the community reintegration. It can be community wellness and screening, ergonomics. So there's many different ones on here, but then there's also blank ones for the student to fill in, saying, well, we did this one skill, but it's not listed on there. So then they can list that in their site specific in the blanks, and then they get that added to their skills checkoffs list. So here are a couple of course syllabus. It's hard for you to see it. I'm sorry, it's kind of small, so I'll just kind of walk through it. Now, every school has a different grading policy. So each school has determined how is their grading policy going to be. Is it pass fail? Do they actually get grades A, B, C? So every school determines the best way for them to do it. This example here goes along with one of the earlier clinicals on the left syllabus, and then on that right syllabus is one of the criteria for one of the later clinicals. So on the left, like the professional skills, they need to complete 7 out of the 10 professional skills. And then on the right, the later ones, they need to complete all professional skills by the time they end that last clinical. And then each of these, like the history, the tests and measures, for this example here, complete 6 out of the 14 skills. at one of the earlier rotations. But then one of the later rotations, it's complete 10 out of the 14 skills. So every school is able to determine what all that they want these students to meet, and how much are they putting in. Each rotation can be graded separately and different, and it can gradually get more and more. All right.
Okay, so I'll take it back for a moment. So Beth did a nice job of explaining the overview of the tool and the various skills defined, and then implementing the tool, how we utilize it. As Beth said, each school does things differently. So I know in discussing with other directors of clinical education within the Texas Consortium, we may implement slightly differently in our interpretations of the tool. And so know that that is determined as you're developing your program, if it's a new program like Chris's, or if you are just considering a different tool option and how you'll implement that. And so the beauty of the PT MACS, from my humble opinion, is it objectively outlines the clinical expectations for the student and the clinical instructor. They come in with a mapped plan of what skills do need to be attained, what the expectations are for each clinical experience. And similarly to Beth's syllabi that she shared, the syllabi for my students, expectations, the performance and the challenges increase from clinical to clinical as they learn more in their curriculum and further develop their skills. The use of the skills in the objective measures within the tool, as well as comments provided by the clinical instructors and the students, can help us to identify any concerns, any challenges the students may have during a clinical experience. And that helps us to effectively develop an action plan with measurable goal writing to determine clearly how the student needs to improve and perform in order to advance to an entry-level rating as they finalize their clinical experience. So from that perspective, I find it very, very valuable to have a clear understanding of what the challenges are for the student. The CI has made their comments within the midterm PT MACS. I have the skills of concern listed. And so it's just taking the time to identify those, and the tool can then be utilized to build an action plan that is more the DCE's responsibility. But the students can write their own goals and spend the time in self-reflection of these various skills and how they need to improve. So it allows them to take ownership, to identify areas of concern and how to develop further. And we also have at the bottom of the tool, and you'll see this in the view within Exxat that we'll cover in some upcoming slides, that there is a visual analog scale to give a snapshot in time of how the student is performing overall. Are they meeting the clinical instructor's expectations and performance at the midterm and at the final? And so we look at that and get a sense of performance kind of globally, and also interpret those skill ratings. And so it's recognizing that we wouldn't utilize just the visual analog scale. It doesn't stand alone independently, but gives us a quick overview as we're coming into a midterm experience of how things are going. Okay, and then as far as a new clinical instructor onboarding as a remote adopter, so new to the PT MACS tool, remote in that they are away from the school, the academic side, how we help train them on the tool varies school to school within the consortium, and chatting with how our training is provided. However, we have developed a video, which will need to be updated for PRISM Exxat, so that's coming in the future. But just an overview video for clinical instructors not familiar with the tool on how the intention of the tool, the presentation of it, and just the processes of it. There's also an instructional PDF for them that they can look at. And so another benefit to midterm visits or virtual or phone call visits, so I tend to conduct them for each of my students. I know that's another area of discussion where different schools do different approaches for midterms. But at review of the PT MACS midterm results, I can get a sense of student performance, but also help the clinical instructor understand how to fill out the form, fill out the tool. So if they're giving an NI rating, the not independent rating, and then in the comments that they're prompted to provide comments for that NI, if it says has not had the opportunity to practice this skill yet or has not had enough exposure, that skill should have been rated NA, not applicable. And so we can just have a brief discussion at that point to help them understand that. So we need to be fair to the student and ensure they have the opportunities to hone that skill before we rate them on their performance. So that's a nice time to share that information with the clinical instructor. The other piece I do like to particularly remind students of is that they do have their clinical syllabus, and that is their key of what is needed for them to meet entry level for particular skills. And so that reference needs to be shared with the clinical instructor so they can prioritize the final weeks of the clinical experience to ensure success, and they can focus on those required skills. And then if there are other skills that happen to occur organically within the experience, they can practice those skills as well. Okay, and then Beth, I believe you will take over from here. This is just the overview of what will transpire within Exxat as the student initiates the PT MACS tool. Do you want to take it from here? Or would you like me to talk through this slide and then you can go through?
Go ahead, Jean. I have not prepared myself on this slide. I'm sorry.
No problem. So this is just an outline of what Beth will cover in a moment, advancing the Exxat PRISM views of the tool. And so at the midterm and again at the final, a student will open the PT MACS tool and enter in their ratings and comments as needed and submit the tool. And it is sent by email through Exxat to the clinical instructor. And then the clinical instructor receives that link and accesses the student's tool and is able to then enter their ratings at that midterm and separately then at the final, providing their ratings and any comments that they need to include for things of not independent or unacceptable. The CI also has summative comment sections where they can provide an overview of performance for those 5 different sections of the tool. Finally, that visual analog scale I mentioned earlier, it's titled The Evaluation of Student Performance. And so the CI will mark the student on a 0 to 10 scale there before they submit the form. So they will complete and submit the form, and it is sent back to the student to electronically attest to or acknowledge the ratings that the CI provided at the midterm, and then again at the final. And afterwards, the Director of Clinical Education or the ACCE would review the tool and finalize it within Exxat.
Okay, so I think we have, so Jean, you want me to talk, right?
Sure, yeah, if you'd like to take them through, and the slides actually show some of the objectives too that we talked about.
Okay, so we have, we're gonna just walk through. We're kind of getting a little short on time, so I'll just kind of run through this. The student fills out their portion of the PT MACS first. And so as you can kind of see on here, again, it's small, sorry, you can't maybe read it, but you can see after all the words that there's check boxes that the students can check themselves on. Are they a plus? Are they a check mark? Are they an NI? Is it an NA? And hopefully it's not a U. But the question, it's stated out on there. So like this first one is professionalism. And then it has descriptions of what they expect, for the most part, what that professionalism looks like. So each skill isn't just thrown in there, but it has a description of what the CI can read through and what does this really mean, and does the student meet it. So the student goes through and grades themselves through the whole assessment. So they can just click on each of them. Or do they feel like they are above entry level? Or are they meeting that entry level component and get a check mark? Or do they feel like they need more supervision and do an NI? So they go through the entire thing, check themselves off. So then once they complete that, then they come to a section where they will actually send their part of the PT MACS through Exxat to their CI. So when they do, they'll say submit, and they'll type in their CI's email. And so this link that goes to their PT MACS only, it doesn't access the student's files or anything else. It's only their PT MACS, goes to their CI. And so then, oh, there right there, it says add clinical instructor at the bottom. So here they would add that information for their CI, put in their email. So then the CI gets an email that looks like this, and they click on the link, and it takes them to the PT MACS, and it shows what the student graded themselves at, and then the CI can grade that student. And there's a comment box for each of the skill, and the CI can write on every single one of them if they want to, but it's not mandatory. If they choose an NI or lower, then they have to put some sort of a comment as to why that student hasn't met that skill just yet. So check mark or a plus, they may want to go ahead and write in there, this student is doing excellent in this area, I'm impressed with them, blah, 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 blah. But they don't have to. The NIs and the Us, they do have to have a comment in that section. So then the CI will go through the entire thing. It is submitted, and then they do the same process for the final. So at the end, the CI and the student are able to look through the PT MACS, and they're able to see at the beginning, the midterm, any comments, and then both sets of ratings at the final and all the comments. And they're able to kind of see that improvement from midterm to final, but then also see all those comments, things that they may still need to be working on during that final assessments, things that they need to work on for that next rotation or so forth. Why maybe they didn't meet that skill. But hopefully at that point, from the midterm, they can look and see and document which ones are our NIs, which ones do we still need improvement, and they can focus on that for the rest of that rotation to be able to get those check marks. So it's a good visualization for the student and the CI at the end. Then at the end, the CI does the visual analog scale. So across the board, how is this student doing? If they're meeting expectations, then they should be around a 5. If they are above expectations, we should see them above that 5 towards 6, 7, 8. I've even had some students at a 10 that they are way exceeding any of their expectations for that student in that clinic. So anything under a 5, that means that student is not quite meeting expectations, and we need to maybe have a discussion and see what we need to do about bringing them up to at least meets expectations for that clinic. All right. What is this? Oh, okay. So then after the student and the CI meet together, they go over midterm, they go over the final. Then each of those, when they sit and meet together, then after the CI submits their part of it, either midterm or the final, they submit it, then the student gets to go back onto their PT MACS and they do a student acknowledgement. So there's a place on there for the student to say, yes, we sat down, we talked through all of our skills, I agree, you know, or maybe they don't agree, but they have come to a conclusion that this is their rating. Then the student will click on there that they do acknowledge and that they did review that form with their CI. Now this next section will have Peggy Gleason talk, and Peggy, I'll let you introduce yourself.
Sure. And I'm so sorry, Peggy, to interrupt you, but we do have a few questions that I was holding until the end. So the first question that we had from Meredith was, can the CI see the student's self-assessment prior to rating? I just wanted everyone to hear that question. And yes, CIs will see the student's self-assessment right above their own when they provide one. The next question we have from Meredith is there an option for the SCCE to see the completed evaluation through the platform? And I'm not sure if one of you folks would like to.
As far as the SCCE, the PT MACS is sent to the CI, but not the SCCE. So if the SCCE needs to be involved, then they can sit in with their CI as the CI is going through the rating. But the PT MACS will only be sent to one person. It won't be sent to multiple. Maybe that answered the question.
All right, and then the next question we have is from April. Does the CI see only the skills that the student rated themselves on, or will they have access to all skills? Sometimes students don't realize that they could put something in a particular section.
So they have access to everything. So all skills will need to be filled out. And so the student assesses themselves, either NI, NA, a check mark plus. So they will check off something on every single skill. So then the CI will see all of the skills. It's not just a few. All of them will need to be addressed.
I would add just one thing to that. Any skill sections that are left blank at this time, the student has to fill out in order for it to be rated. So the student completes their midterm portion when the CI goes through to do their midterm ratings. If the student didn't enter in something the CI would like to add, the CI is not able to add it at that time. But they can prompt the student to enter it on the final version of the PT MACS so they can capture it at the end of the clinical if they'd like.
All right, and our last question here from April, at the time of student acknowledgement, if they don't agree, how do they change it?
I know for my school, I tell my students to tell the CI not to submit their portion of it until they sit and talk about it. So then once the CI and the student talk together and go through all the ratings, if there's some that the CI says, oh yeah, I do remember you did this and this and this and you were completely independent, I need to change this grading, then they can go through and change it at that point because they haven't submitted it yet. But if they have already submitted it, then for me, the student tells me, you know, what happened. So then I have the CI actually email me what should have been graded. And then Jean, on the new updated PT MACS, are we able to change that specific grade?
Yes, yeah. So just the differences in version 3 versus version of Exxat. We do have admin editing ability. We can also send the tool back to the clinical instructor to edit themselves. So to do that.
Okay. Okay. So there are opportunities for us to change but again, I don't take the student's word for it. I get it in writing from the CI if we need to make changes. Rosia, we good on that?
Yes, no more additional questions. Thank you so much.
Okay. Peggy, it's you.
All right. Well, thanks. I appreciate being on this webinar. I suspect that I have two roles here. One is someone who has been around since the Blue MACS era. So from a historical perspective, there aren't that many of us around, I think, anymore. But in addition to that, I am also here to give a little bit of perspective about CAPTE, as I am the current chair of CAPTE. So it's a happy coincidence there. It has been mentioned that the 7 Ds are where the PT MACS and any assessment tool can help a lot with documenting progress in those areas. I did want to let people know that we were in the middle of a revision of the standards and required elements. So what is currently being used went into effect in 2016. In 2024, we expect the new revisions to go into effect, and the 7 Ds will decrease in number from a current 43 to 25. For those of you who have not made yourselves available to look at the current second draft of the standards and required elements that will go into effect in 24. You can simply find that on CAPTE Online, all one word, .org, and put in and search for the accreditation handbook. And in there, you will find a link to both the PT and PTA. What that will look like, it is considerably less detailed, and there is more left up to the programs to determine what they're going to teach and how they're going to teach it. In response to that, once the standards have been voted on and go into effect in January of 2024, then the consortium will look at the PT MACS and start working on a revision to address those new standards in a way that's easier for, or will be easier for, programs to tie them together. It's not like the current PT MACS won't be able to do that. It certainly will, but we will, our revisions will be looking at how do we kind of dovetail the new revisions with the PT MACS. So that's one thing. CAPTE's perspective, sometimes people think, well, the CPI is an APTA tool, which it is. And therefore, I should, especially with new programs, I should use the CPI because that's what's expected. And CAPTE has no position on what you should use. CAPTE says that what assessment tool you use is determined by you, and you need to justify why you've decided that that particular tool is the one that best suits your students, your faculty, and your clinical faculty. And they just justify why you're using it. And there are programs that use both. There are programs that use more than one, depending on early rotations versus final rotations. So I just want to be really clear that CAPTE does not dictate that you use the CPI or the PT MACS or the CIET or anything else. You can even do, you can still use homegrown assessment tools, but you need to be able to document why you think that meets your needs in an effective manner. So I did want to be really clear about that. One of the benefits of first the Blue MACS and then the PT MACS is that there is the option, there is the ability to see a student's clinical history. And there are different opinions about this. There are some people that think, oh, a current CI should not be able to see how a student did on a previous clinical rotation. There are others that think, okay, we consider our clinical instructors clinical faculty. They are our faculty. And no faculty in your programs would be blind to what a student's history has been in the classroom. You discuss this all the time in your faculty meetings. You let people know, especially if there are issues that need to have maybe a closer eye or more concerted effort to bring the student along. We can't have it both ways. Our clinical faculty need that information as well. That ability for them to see the history when we had an actual book, a paper book, the student would hand the CI that book, and it had all the documentation from previous clinical rotations because it was one book that was used the whole way. In the electronic version, the student also has the ability to make previous clinical rotation documentation available to the CI. The CI actually has to, A, know that that's a possibility, and then 2, ask the student to make that available. But that, to us, when we were developing this instrument, was key in terms of helping the student, helping the clinical instructor, not keeping them in the dark about what went on in a student's previous rotation, because it really does contribute to how they manage the current rotation that they're in by knowing what the student, where they struggled, where they're good, those kinds of things. So please think about how you treat your clinical faculty and how you make information available to them about the student's clinical history, just like the faculty know from a classroom and lab standpoint. Adjustments to the ratings over time. We used to have an NE, which was needs experience, and that turned out to be somewhat of a cop-out of clinical instructors who did not necessarily want to commit. And we realized when we did the last revision of the PT MACS that we all need experience. That tells a student nothing. We all need more experience. And so we did 2 things. We dropped the NE, and we also changed the NI. It used to be needs improvement, which clinical instructors, being as sweet as they are, didn't like to say things like that. And we changed the definition of the NI to not independent. And that is a little bit more objective. There are reasons you're not independent. So there is no NE anymore. Although if you get some really seasoned clinical instructors out there, they like to kind of try to bring that back if they can. The electronic version prevents that from happening. The VAS has been talked about already. And the only other thing that I wanted to bring up is that there is a PTA MACS as well that is still available. Even though the PT MACS is not available in book form, the PTA MACS is still available in book form or an electronic form through Exxat. So the same individual manages that process, and that is Michelle Voigt, who is the program director at Houston Community College here in Houston. So if you know someone from a PTA program or want to share this information with them, it's the same kind, it really is based on the PT MACS, and it was started in around 1982, and their most recent revision was in 2018, but that is available to anybody who wants that. So that's my 2 bits.
All right, so I am Erin Hicks. I'm a PT at the West Texas Rehab Center in Abilene, Texas. And I've been a PT for 18 years, a CI for the last 17, and then also the SCCE at the rehab for the last 13 years. So they asked me to speak to you a little bit on kind of the clinic side and get some of the pros and cons and viewpoints from the clinic aspect, the opinions of CIs and SCCEs. And so I actually put my own opinions in there as well, but I did take a poll of several different CIs too. And so I kind of compiled all of our thoughts together in these next few slides. So if you want to go ahead and go to that next slide. The big one, this has already been brought up a couple of times now. You've already heard this, so hopefully you see that it's a really important point to all of us, to the schools and to the clinicians. But the PT MACS really does paint, we feel like, a better, more detailed picture of the student's actual performance on really specific individualized tasks. As it was mentioned earlier, a lot of the other tools take more of just a broad category like evaluations or manual skills, things like that, and you have to just grade the student in one big lump sum. But just like Beth mentioned earlier, you know, using the example of evaluations, the student may be really efficient at obtaining an appropriate subjective history, conducting appropriate tests and measures, but maybe they're not quite there yet with developing an appropriate plan of care or coming up with a good prognosis for that patient. And so if you have to lump the whole eval together, you're either having to grade them down lower on the first part that they were really good at, or you're having to maybe grade them higher than they should on the second part that they're not as good at. So it's just really not as clear a picture for anyone involved. But again, if you can actually break it apart and grade them on the subjective, the specific objective tests and measures that they're doing, developing the plan of care, coming up with diagnosis, prognosis, you really do get a better picture of where maybe they need to step up a little bit. It helps them to know what they need to work on a little bit more, and also gives the DCE and the school a better viewpoint of where they are at that point in time. For the next point, you can move on to the next slide there. Definitely a much simpler grading scale. You've already kind of seen it in a lot of detail now. You just have those 5 main categories that you're picking from, and they're very simple and very straightforward. So there's not a lot of guesswork involved, which to me is how it should be. You shouldn't be guessing how to grade them. You should be fairly confident that, you know, either yes, they're exactly where they need to be, or they're not quite there yet, but they're working on it, or above and beyond, again, as already mentioned. So it's just, again, very quick and easy to fill out, not as complicated, less room for errors. I feel like with, we'll just say the CPI, for example, to me personally, and to a lot of the other people that I spoke with, their grading system is just very confusing and complicated. There are more categories that you have to pick from, and under each category, there are several criteria that have to be met. You know, the student has to treat this percentage of this type of caseload and this percentage of this type of caseload and do this and do this and do this to be graded in that one category. And so again, sometimes you almost feel like you're kind of trying to guess or decide, well, do they fall more in the criteria of this or more in the criteria of this? And so to me, the PT MACS is just much more straightforward and simple. Also, again, as already mentioned, you don't necessarily get locked into having to spend a ton of extra time typing your comments. You're free to type as many comments as you need to, but you're not required to fill in something for everything if they've already been checked off. There's no concerns, everything's going well. I also feel like it limits the repetitiveness of the comments that you are typing. I feel like in some of the other tools, I end up getting very frustrated and feeling like I'm wasting a little bit of my time just retyping the same things over and over again, answering the same questions that are just listed in multiple sections. And so I feel like with the PT MACS, there's still maybe a tad of that, but not nearly as much as a lot of the other ones. So you don't, again, feel like you're wasting as much time or just having to repeat yourself stating the same thing over and over again. For the next one, you know, we were talking about the being user-friendly and being simple on the grading scale itself. Really just the whole tool is also that way. It's very user-friendly. It's very simple. You can look at it for the first time ever and very easily figure out what you're supposed to be doing, clicking through it. Again, as mentioned, there is training that is available for it if you feel like you need it, which is nice, but there's not as much of that that's actually required. Some of the other ones require actual CEU courses or training sessions that you have to sit and watch lots of videos and take tests over it at the end. And so it's nice to have it if you need it, but not feel like you're forced to do it if you don't. And then again, looking at that visual analog scale, that sliding bar scale, we love that. That's a great tool for us to, after we've typed all the specific things and graded them on all the specific things, it really just ties everything together nicely, and it gives you just one quick glance. It kind of paints the full picture so that the student or the DCE or us or whoever is looking at it can just, again, boom, they look at it and they know exactly if that student's where they need to be, or if they're doing a little bit better than that, or, well, maybe we need to work on something. And then again, look at the details and see where do we need to work a little bit more. I've found it a very helpful tool, again, for just the students themselves. After you've kind of sat down and gone over everything, it really shows them where they are and shows them, again, if they are doing the right things, they need to just keep doing what they're doing, or do they need to pick it up a little bit because they're not quite where we would expect them to be at this point. And now we'll talk just a little bit about the cons. You know, really, there were not that many cons that were listed, and even the ones that were, everybody kind of said really weren't that big of a deal. They were just fishing, trying to get something to say to me when I was asking. Or, you know, some of the cons that were listed were things that you would get with any of the tools. It wasn't specific to the PT MACS. It was just in general, you'd be dealing with that with any of the grading tools. So one of the main things, as mentioned earlier, there are a lot more specific categories. So it is a little bit longer form. So that was a con for some people, is that it felt longer, felt like there was more they had to do. However, most people agreed that because it is so quick and easy to go through, that even though physically it may be a little bit longer of a template or longer of a form, it really took about the same amount of time for them to fill out because they weren't getting so bogged down in the categories and the grading and all of those things. So really, that could be a con, but it did flow pretty quickly for most people. I think where that would come into play more, and you can see on one of my bullet points there, is if the student is not getting checked off on a lot of things, if they are getting NIs or lower, you are having to write, of course, more comments. And so that's where it could take maybe a little bit longer with the more categories that you have in there. And the other big thing that was brought up that, again, wasn't really that big of a deal, but a few people had some issues with it being just the computer-based. They would get maybe a glitch. It would freeze up on them when they were trying to hit save or trying to advance on to the next part, or just something along those lines, computer-based. But again, that's going to be something that you'll get with any computer-based grading system that you're using. It's not going to be independent to the PT MACS. And it was not something that was happening just horribly, not on a regular basis. It was just a here and there thing that a few people had experienced. So really, there are lots of other things we could say about it, but trying to keep it short and sweet for you guys. Those are kind of the main pros and cons that we were hearing over and over again from different people.
Okay, this is the last slide, and I did a quick poll of the Texas Consortium PT program. So there are 14 within the consortium that utilize the PT MACS for their clinical education design, and I received 50% response, so pretty good for a quick survey. Of those that responded, 5 DCEs have gone through the accreditation process and 2 had not yet. Of the 5 that responded, 1 has gone through the process 3 times. So 8 results of accreditation were discussed in this brief poll, and 8 of 8 had no issues raised by CAPG related to utilizing the PT MACS, and they had no ClinEd issues raised in general with their review process. So I thought that'd be a nice positive note to end on. Oops. Okay, so Rocio, do we have any questions that we can address?
Not as of now. All of the questions came in earlier about the workflow, but folks, if you do have a question, feel free to add it in the questions box. If you have a question you'd like to voice out, you can also raise your hand and I can go ahead and unmute you since we have a few minutes, but we'll see if anything comes through. All right, it looks like there are no follow-up or additional questions.
Very good. Okay, well, thank you all again for spending your Friday morning, afternoon, depending on where you live, with us here, and hopefully you learned some helpful facts in making a decision on whether the PT MACS is the right tool for you. And you can reach out to Rocio. She can certainly send questions on to us if you do have additional questions that arise after the webinar ends. We'd love to be able to interact with you and share any valuable information we can provide.
All right, and that brings us to the end of this webinar. If you have a few minutes, we'd love to hear from you. Stick around once this webinar ends for a short survey to let us know how we're doing, what can be improved, and any additional topics you'd like to see in the future. Have a great rest of your day, everyone.
All right.
Thank you.